Type 1 diabetes requires daily management, but emergencies can still happen. Knowing when to seek emergency care can save your life. Let's go over the key warning signs and what to do if you or a loved one experiences them. If your blood sugar stays above 200 mg per deciliter and you feel unwell, you may be developing diabetic ketoacidosis, DKA, a life-threatening emergency. Check your ketones. If your urine ketone are moderate or large, or your blood ketone is greater or is high than 3 millimole per L, most likely you have DKA. Low blood sugar can turn dangerous fast. If it drops below 54 mg per deciliter, your brain may not get enough glucose to function. Severe hypoglycemia, when to go to the ER, loss of consciousness or seizures, extreme confusion, unable to speak clearly, repeated low blood sugars despite eating glucose, no access to glucagon or unable to swallow safely. Pro tip, if a person is unconscious or having a seizure, do not force food or drink. Use a glucagon injection or nasal spray and call 911. Never drive yourself to the hospital. If you're sick and can't keep fluids down, dehydration can make your blood sugar skyrocket and worsen ketone levels. Persistent vomiting, fever over 101 Fahrenheit with high blood sugar, not urinating for 6+ hours, feeling dizzy when standing, a wound or infection that looks red, swollen, or oozing. If you're sick, check your blood sugar every 1 to 2 hours and stay hydrated, and take your insulin per sliding scale. If symptoms get worse despite home care, seek medical attention, go to the ER. Sometimes diabetes-related issues can mask other serious problems. Seek emergency care if you experience severe chest pain or irregular heartbeat, sudden vision loss or slurred speech, extreme confusion or inability to stay awake, or any situation where you don't feel safe managing your diabetes at home. It's better to be safe than sorry. Never ignore symptoms that feel off or worsen quickly. The best way to avoid emergencies is preparation. Make sure you always have an emergency kit with glucose, ketone strips, and glucagon. A medical ID bracelet. First responders need to know you have diabetes. A sick day plan for managing illness and high blood sugar. Family and friends who know how to help in an emergency. Final tip, if you have an insulin pump, keep the pump support number in your phone. Keep your doctor's number in your phone and ready to call 911. When in doubt, seek help. Your health is priceless. Never hesitate to call 911 or go to the ER if needed. ER for DKA, severe low blood sugar, persistent vomiting, infections, chest pain, or confusion. Call 911 if you or someone else is unconscious, seizing, or severely ill. Be prepared, monitor, hydrate, and have an emergency plan. If you found this video helpful, share it with others who have type 1 diabetes. Subscribe for more diabetes care tips. Visit bowendoclinic-.com for more resources. This video will guide you on when to go to the emergency room for type 1 diabetes emergencies. Understanding the signs of diabetic ketoacidosis and severe hypoglycemia is crucial. Recognizing severe dehydration and infections can prevent emergencies. Prevention and preparedness are key to managing diabetes effectively. Discuss with your caregiver when to seek emergency care for diabetes-related issues.